Namaste, hello friends. I'm Dr. Divya Sitlani. I'm also a diabetic educator. Today we will be dealing with part 5 of the diabetes, understanding diabetes as well as managing diabetes. Let's get started. I'll just share my screen. So today we will be understanding the concept of insulin resistance, which is also known as IR. So if you have a lot of craving for sweets and salty foods, yes, sweet as well as salty, okay, then you are having symptoms of insulin resistance. If you are experiencing a lot of fatigue, even though you're eating well, okay, but a lot of fatigue, sign of insulin resistance. Frequent or increased, both frequent or increased urination, insulin resistance. Tingling sensations on the hands and the feet, insulin resistance. Increased hunger or thirst and darkening of the skin in the groins, in the armpits or behind the neck. I told you these three signs in part 1. Skin tags, darkening of the skin in the armpits, and acanthosis nigra, which is the skin of your neck region becomes dark. So these are also symptoms known as pre-diabetes. Now, what exactly is this insulin resistance? Remember about the chewing gum which I spoke to you about? That sticky thing which is there on the mouth of your cells, which is not allowing the insulin. And again, so much of insulin is there in the bloodstream. But ideally, if we do not remove that sticky substance, how do you think the cells will be able to take in the glucose for energy? So this is the glucose, this is insulin, this is the cell, and because there is insulin resistance, the glucose does not go inside the cell. Okay, so this is it. What happens? What are the symptoms? How do we manifest insulin resistance? So what happens is you have a high carb diet. So usually the burger, the French fries, the Coke is considered as high carb diet. Okay, high carb, refined carb. There is a constant high glucose in the blood. High glucose, so more insulin is called upon. How much? Even if you eat small one cashew, insulin has to be secreted to convert that into energy, okay, to put it into the cells. So more glucose contained in the blood, you will constantly have high insulin demand. What is the pancreas signal? So pancreas insulin receptors, it secretes insulin, but those receptors, those chewing gum receptors become resistant. Okay, so this is the concept of insulin resistance. Now, because the cells are constantly starving, cells are not getting energy because the glucose molecules are not able to go inside the cell. There is constant high glucose level in the blood, high insulin also. Insulin and glucose are directly proportional, and you will be having a lot of hunger and cravings. Lot of hunger and cravings. Very important to understand why diabetics are constantly in the state of hunger. Okay, now let us understand one more concept. Now what we usually do is, we go and get ourselves tested for, what do we test in the morning? We test our plus fasting blood sugars. Fasting blood sugars. But what if I don't have insulin only in my body? Okay, are you understanding what I'm talking about? We usually prick ourselves fasting blood sugars, we check blood sugars. But ideally, you should be checking fasting insulin in the morning, fasting insulin. So there is a model which is known as HOMA-IR. So the next time you can be going to the, now this is not to be done in your house. You need a pathological lab for this. Okay, my dear friends. So this is a concept known as HOMA-IR. You need to go fasting to the lab and ask the technician to do your HOMA-IR or fasting insulin, not fasting blood sugars, fasting insulin. So what's the full form? It's homeostatic model assessment for insulin resistance. Okay. Now these are the fasting glucose multiplied by fasting insulin upon this. This is the way you calculate it. Okay. Also, there's another, a value greater than 2. indicates insulin resistance. So suppose you get your HOMA IR and your value is more than 2, it certainly means that you are insulin resistant. Okay. So this is not certainly diabetes, but you need to get this done. And in fact, diabetics also need to get it done to see how much of insulin resistance is there in your body. Okay. So fasting insulin. And there's another test which is known as a quickie, which is quantitative insulin sensitivity check. They both correlate reasonably with the clamping. So higher ranges. Now see, this is the way. Less than 1, insulin sensitive. Okay. Low diabetes risk. Now more than 1.9 is insulin resistance. Okay. Borderline diabetes risk. Borderline diabetes risk. And third one is significant. If it's more than 2.9, it's significant insulin resistance. High diabetes risk. Okay, significant insulin resistance. What does HOMA IR do? HOMA IR test determines your insulin resistance level. Higher the range indicates greater resistance. Smaller the number, the safer you are. Okay, so if it's more than 2, really, really dangerous. And if it's more than 2.9, there is significant insulin resistance and there is high diabetes risk. Okay, so fasting insulin 85. This is the calculator. Fasting insulin, HOMA IR is calculated like this. So what is the solution? What do you do? Suppose you realize, okay, I am insulin resistant, I am overweight, I am obese. The trick is you reduce the weight. Automatically you change your next session. We will be speaking about the diet. And once you work on your weight reduction, you will be reducing insulin sensitivity too. Insulin resistance too. Okay. Thank you. And hello friends, Namaste. I'm Dr. Divya Sitlani. I'm a homeopath and a diabetic educator. Today we are into part 6 of the Understand and Manage Diabetes camp. Let's get started and just share my screen. So today we are going to understand the concept of GI. We've heard a lot about GI, what is GI, So glycemic index, what does it mean? So the carbs, every carb is ranked from 0 to 100, okay? 0 to 100, according to how much they cause the blood sugar to rise after they are eating, okay? After they are eaten. So every carb has a number. Carbs from 0 to 100, according to how much they cause the blood sugar to rise after they are eaten. So there are foods with a low glycemic index, then there are foods with a medium glycemic index, and then there are foods with a high glycemic index. Okay, so from 0 to 100. Highest will be somewhere near 100. So let us study. Now, various charts will be giving you various readings, but we must understand that the snacks, the starch, all these are not a great idea. See, the readings will be different everywhere. They will be different in all the places. So your vegetables, your apples, and your dairy, you have to keep comparing. So what are basically the high GI foods? So potatoes are considered as high GI. Rice is also considered as very high glycemic index. Honey, don't be under the impression that diabetics can get away with, eating honey because it's not directly sugar. Your beverages, your soft drinks, very, 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 very high glycemic index. And your bread also has a high glycemic index. Okay. Now, what is the ideal diet for diabetics? It is said that instead of replacing your carbs, like suppose your parathas, your idlis, your dalia, your upmas, your bread toast, okay, you need to eliminate all those carbs for breakfast, because what do? They give rise to instant sugar rice. And you need to introduce protein-based breakfast. So what are protein-based breakfast? They can be your dal-based breakfast, okay? Your moong dal pesarattu. They can be your yellow chana dal dhoklas. They can be your yellow chana dal chilas. And it's a great idea to be introducing a lot of, or mixing a lot of vegetables into your chilas. Okay. Now, what does this all do? It will go on decreasing the glycemic index of your food. Okay. And then one thing majorly important is that low glycemic foods will be having high satiety factor. What is the meaning of this? Suppose you have these dal-based, protein-based breakfast, you will be satiated for a longer period of time. You will not start feeling hungry. But then if you eat a paratha, if you eat bread, then again, suppose you had it at 9 o'clock, by 11 and 11:30, again, you're a little hungry. So that is low satiety. Okay. So it's a great idea to be introducing dal-based breakfast. Also, we will be learning to understand and learning foods according to the various glycemic index. So suppose you are, out of station, you don't know what to do, you have to eat a wheat roti. What you can do is mix a lot of, you can grate, bottle gourd, or, you can grate carrots, you can grate many other, even the gobis, or the cauliflower, you can grate it inside, and then you can have that, because that will reduce the glycemic index of that particular chapati. So this is the way you can differentiate between medium glycemic index, high glycemic, that is the refined foods, and low glycemic index foods. But here again, all the charts will vary. The great idea is to have that consume that particular food item, and then get your blood sugars checked. Sometimes nachni is a thing. Some people feel that after nachni the blood sugar increases. Some are okay with it. So even when you're introducing the millets first time, always check your blood sugar, see how much of a rise is occurring, and then you can set in a balance to yourself itself. So what do? Eat bad carbs, they make insulin, cells resist, that's insulin resistance, sugar stores as fat, and you feel hungry and tired all the time. Okay, so that is something known as insulin resistance. Now, what is your health and your glycemic index? So again, high glycemic index releases energy very, very quickly, feel hungry soon, and you will end up eating more. Whereas when you consume the low glycemic index foods, they will release energy slowly, and you will feel fuller for longer period of time, and then certainly you will eat less and consume less. So you can reset your eating habits. How? By managing and learning about the glycemic index of each food, and then having it in the proper way. Now, it's a great idea. Suppose you are creating a thali for yourself. What you can be doing is that you can be in the thali, what you will do is you will take 3 vatis. For one roti, for one chapati, you will have 1 vati of dal, 1 vati of the vegetable, and 1 vati of salad. 1 chapati, and these 3 vatis have to come along with it. If you need the second chapati, again you will have 1 vati of dal, 1 vati of vegetable, and 1 vati of salad. Do you think you will be able to eat the third chapati? Certainly not. Okay. So this is a good idea to plan your thali or your balanced meal. Go low on the carbs and have the other 3 vatis. Okay. Now, this is a great introduction in today's time. Green smoothie. Okay. How do? You take a base. You can be, usually for diabetics, it has been seen that a vegan diet controls or manages the inflammation. So you should restrict yourself from dairy. You can be introducing plant-based milks, which are almond milk, your cashew milk, or your coconut milk, again in limits. And then you can sweeten it naturally with, a frozen fruit or dates. Then you can be adding the big leaves, like the palaks are big leaves, but palaks again twice a week, because it has oxalates, okay, and phytates. And then the smaller leaves, that's the kothmi, the small of the pudina, you need to take them in a good ratio. Okay. And then you can be adding your chia seeds, you can be adding ground cinnamon, which helps in the management of blood sugars, as well as flax seeds. Okay. So there are various, combinations you can try out, which suits your family and you the best. And then you can go ahead with this. So we also have to understand what is excess body fat that leads to chronic inflammation. Insulin resistance, this will again dyslipidemia, hypertension, elevated fasting glucose, type 2 diabetes, cardiovascular diseases, arthritis, cancer, and Alzheimer's, which are all inflammatory in origin. Now, let us understand the concept of C peptide. What do you think is C peptide? Okay, so as I mentioned to you about HOMA IR, we need to also check our C peptides. So it's a biologically inactive peptide formed when beta cells of the pancreas convert pro-insulin to insulin. So insulin and C peptide are secreted simultaneously. Okay, most of the C peptide is excreted by the kidneys. C peptide levels usually correlate with insulin levels and provide a reliable indication of how well the pancreatic beta cells secrete insulin. So before starting with any medication, you should be knowing if you really have insulin in your body. And who will tell you that? The C peptide will tell you whether you really have how much of insulin. Okay. So what does it mean when your C peptide is low? With type 1 diabetes, your pancreas makes little or no insulin, we learned, and little or no C-peptide, both are released together. With type 2 diabetes, the body makes insulin but doesn't use it well. Remember I told you sedentary lifestyle, those chewing gum kind of things. This can cause the C-peptide levels to be higher than normal. The test may also be used to find the cause of low blood sugar, also known as hypoglycemia. What is the difference between C-peptide and insulin? Aren't you really curious? So C-peptide and insulin are released from the pancreas at the same time and in about equal amounts. So a C-peptide test can show you how much insulin your body is making. This test can be a good way to measure insulin levels because C-peptide tends to stay in the body longer than insulin. Okay, so because of C-peptide, you can understand how much of insulin your body is actually making. And the normal range for fasting blood C-peptide levels is around 0.8 to 3.85 nanograms per milliliter. Okay, and ranges can be varying in different laboratories. Okay, so the C-peptide, what do you think? It measures the amount of insulin made in the body, can differentiate between the insulin the body makes and the insulin which is taken as a medication. Yes, it can differentiate whether it's external or your body manufactured insulin. It can help you to differentiate between type 1 and type 2. The type 1 diabetes autoimmune condition, pancreas does not produce insulin. Type 2 is a metabolic condition in which body doesn't use that insulin that's produced as well as it should. It's produced, but body is not able to use it because of that chewing gum. The test is especially useful in adult onset autoimmune diabetes, which is often misdiagnosed as type 2 diabetes. Very, very important. Monitor diabetes, doctors can use a C-peptide test to decide whether you need to take insulin or adjust the dose. If you are already taking it, you can investigate the reason for your low blood sugars or hypoglycemia, help you diagnose a tumor. Maybe you have a tumor in the pancreas, which is secreting a lot of insulin, and you can monitor the situation after pancreas removal or transplantation. Okay, so again, insulin resistance, high C-peptide indicates the body is producing too much insulin. This happens in insulin resistance. The body produces more and more insulin, but the cells protest, they fight, they retaliate. They don't respond to insulin and become insulin resistance. Studies have shown that a higher C-peptide level can predict insulin resistance in both healthy as well as those with diabetes. So it's a good idea. Even if you don't have diabetes, you should be getting your C-peptide levels monitored. What is exactly metabolic syndrome? This is also very nice and important to understand. It's a group of health problems that occur together and increase the risk of diabetes part 2 and heart failure. So what are the symptoms? If you have high blood sugar, high blood pressure, increased body fat around the waist, low HDL cholesterol and high triglycerides, any three, then you can be called as having metabolic syndrome. So read them again: high blood sugar, high blood pressure, increased body fat around the waist, low HDL cholesterol, as well as high triglycerides and or you can be labeled as metabolic syndrome capable, So two types of complications of diabetes. One is the capillaries, as I told you, the smaller ones, that's retinopathy, nephropathy, the kidneys, and neuropathy, the tingling, numbness. And if the major arteries, then you can be having coronary as well as cerebrovascular diseases. Major arteries and minor arteries. So this is the slide we had taken earlier. Now let us differentiate the kinds of hypoglycemia. Why this slide is important? Sometimes you don't know the symptom. Actually, it's a hypoglycemic attack happening, but you are not aware of the symptoms. So pay attention. It can be manifesting as shaking, fast heartbeat, hunger, anxious, dizziness, sweating, impaired vision, weakness, fatigue, headache, and irritability. So see, if you're irritable also, it can be having a problem of hypoglycemia episode. What do you do is to combat this, half glass of juice or regular soft drink or simple nimbu pani. Simple nimbu pani. Okay. So this is the way you need to manage it. So thank you.
Help Talks are daily health related talks held at Health Education Library for People, Mumbai, India. For more information visit www.healthlibrary.com. Subscribe to Help Talks channel. Be better informed about your health.